Hi, Ray Sievert with Tracy Technologies. We have an interesting case today that I think will make a lot of you laser refractive guys really stand up and notice what iTrace tells you about lens optics as well as corneal optics. And also for cataract surgeons, it should probably scare you a little bit that this type of situation is going on. Let's take a look at what we've got. So this is an older patient who's had several refractive procedures. You can notice it's 1, 2, 3, 4 cut RK plus PRK in his right eye. His cornea is reasonably good, not perfect, but his lens optics are poor. And his lens is clear based on an opacity grade of less than 2.5 out of 5. So this is a clear lens that the patient doesn't see well. Now, imagine this post-refractive patient shows up in your practice, and it's a little hard to get a refraction. Tracy refraction's in yellow, which says it's not a very crisp refraction. And so you're wondering, well, I guess it's his prior refractive surgery. You'd be wrong. It's not his prior refractive surgery. That's not the problem. The problem now is his lens optics. And so you may guess, based on his age, he was 64 at the time, that he probably needs cataract surgery. And if you guessed correctly, you'd get it right. You do a cataract surgery, you fix this, and all of a sudden the patient's going to see like that. He'd be reasonably happy. Certainly, I would hope you would not want to do more refractive surgery on his cornea. The problem is, and oh, by the way, his optical alignment's quite good. So you'll come out with a good result. He doesn't need a toric lens. He just needs an IOL. The problem is, now he's going to come back to you, and he's going to say, let's do that same thing in the other eye, because it was so good on the first eye. Here's where the problem comes in. Again, prior refractive surgery, this time 1, 2, 3, 4, 5, 6 cut RK plus PRK. And so his cornea is not good at all. In fact, it looks like several E's stacked on top of each other. His image from his lens is not very good either, but the score is surprisingly high. An 8.5 on the DLI scale. How's his opacity? Just like the fellow eye, it's clear. So there's nothing that you would observe that says he needs cataract surgery. He would just want it because it fixed his other eye. So what do? Well, you look at his total vision, and other than a little bit of blur, it's not that bad. So his refraction's in green, which means what? It means he just has sphere and cylinder, no high order aberration. This one's a bit of a conundrum. If you take a look at the Chang analysis on this patient, it becomes a little clear what's going on. Here's the aberrations of the cornea. This is what we call chatter. Early aberrations, the bars aren't that big, but they're not in the total eye. Why is that? When you look at red and blue, positive and negative aberrations, they offset. And in fact, his lens is doing a perfect job of compensating his bad cornea. Wait, are you telling me, Ray, that lenses will fix bad corneas? Yes, that is what I'm telling you. And it's only going to be discovered with an iTrace. So in this case, if you take this lens out, this is his compensation mechanism. He's going to go from pretty good vision to pretty bad. Let me show you. Right now, his best corrected acuity with glasses is this. And he's a hyperope, so he doesn't want to be a hyperope. He's a plus 267 with some SIL. His spherical equivalent is about a plus 2. So he's going to go from that best corrected to that. And he will not be your friend. He will not be happy. So what would you do here? Hey, no more refractive surgery on the cornea. No IOL, because that lens is doing Superman work trying to fix the bad cornea. Maybe give him a plus 2 contact lens if he doesn't want glasses. But the fact is, you're not going to really understand the subtleties of how the cornea and lens work together unless you have and learn how to use your iTrace. An interesting case. I hope it makes you think, because lens compensation on post-refractive patients is real. It's out there. And it should scare all of us just a bit to go in and guess that it's probably okay just because the patient refracted crisply. It's not always okay. Sometimes the lens has done tremendous work. Thank you.